And there's a new therapy system designed to prevent lung cancer reoccurrence. In addition to that, adjuvant therapy can also increase a patient's survival rate.
We took the time to speak with an expert and a lung cancer survivor about adjuvant therapy and how it's giving patients a better chance at long-term survival. Take a look. Lung cancer is one of the leading causes of cancer deaths in the U.S., and even with treatments, it remains a serious threat. That's where adjuvant therapy comes in. This morning, we're talking with Dr. Jonathan Vilena Varga and lung cancer survivor Lisa Goldman about how adjuvant therapy is making a real difference in people's lives. Good morning, you two.
Good morning.
Good morning.
How are you doing?
Great.
Very good.
All right, so Doc, I'm coming to you first. I would like you to explain what adjuvant therapy is and why it gives hope to lung cancer patients.
So adjuvant therapy is a therapy that we give along with surgical resection in order to prevent cancers from coming back and basically curing the patient. The reason that we're so excited is there's two new forms of new ways of treating patients that are very, very powerful and have cured a lot of patients thus far and now standard of care.
What is really the difference between these neoadjuvant and peri-adjuvant therapies?
So neoadjuvant therapy is, neo means before, so we give this before surgical resection. What this really does is shrinks the tumor for us, prevents it from coming back. Perioperative or peri-adjuvant is when you give before and after surgery. Again, the idea is that we remove the cancer, we prevent it from coming back with these two new different treatment options. It's very powerful.
Oh, absolutely. And Lisa, you are a lung cancer survivor. Do you mind sharing your story with us?
Sure. I am really fortunate to be able to share with you that I was diagnosed over a decade ago with metastatic stage 4 lung cancer. But I've been doing great. So I initially started with about 9 months of traditional chemotherapy, and luckily we discovered that my cancer had a biomarker called ROS1 that made me eligible for a targeted therapy. So I switched from chemotherapy to a targeted therapy pill that I take twice a day, and I've been lucky enough to be an exceptional responder and been on that medication for over 10 years now.
Wow. Well, congratulations. But really, adjuvant therapy wasn't an option when you were first diagnosed, correct?
Correct. There's been a huge amount of progress in the treatments available to lung cancer patients in the last few years. So while I was diagnosed a decade ago and adjuvant therapy wasn't available to me then, it may very well be a choice that would have been presented to me today. And I would have been very enthusiastic to discuss that with my doctor, as I've seen it extend the life for many patients today.
Wow. And then, doctor, who should really be considered chatting about this type of therapy?
Basically, any patient that has a new diagnosis of lung cancer should speak to their doctor to see if they are a candidate for these types of therapies. Lung cancer treatment has changed so much in the last 5 years that we all now have very different algorithms where a patient can be treated. So you have to speak to your doctor. And I recommend any patient with a diagnosis of lung cancer speak to their doctor about these therapies.
Okay. And then, Lisa, with many lung cancer treatments coming from recent clinical trials, would you be open to joining a trial if you needed more treatment?
I would be more than open. I would be enthusiastically seeking out clinical trials. I've seen so many patients benefit from clinical trials and get many more months and years out of their treatment than they would have been able to get through the standard of care today. So I know that clinical trials can scare a lot of people. There's a lot of unknowns, but basically clinical trials make available tomorrow's treatments today. So clinical trials and research represent hope and opportunities for better care for cancer patients.
It sounds like you're very passionate about lung cancer research.
I'm super passionate about lung cancer research. It's the reason I'm here today. When I was diagnosed, my children were in elementary school, and I wasn't expected to live to see them graduate from elementary school.
Wow.
But thanks to research, I just took my youngest child to college last week and got to help her move into her first dorm room. So, you know, research is all about giving patients better quality of life and longer life to get to those milestones.
Wow. I mean, I just kind of got chills right there when you said that. That's just such an incredible milestone that you were able to see thanks to all this different research that's been done and all these new treatments that are going about. Where can people go to find more information about Adjuvant therapy?
For more information and resources about lung cancer, please go visit lcfamerica.org. That's lcfamerica.org.
Well, thank you two so much for joining me this morning, sharing a little bit more about the different treatments that are available and the successful research that's going on here in the United States of America. Thank you two.
Thank you.
Thank you.
And for more information about the therapy and how it could possibly help you in recovery and your journey, visit the website, which is lcfamerica.org.